And we're live with today's webinar, Andres. Let's get started. All right. Welcome, everybody. My name is Sach Sahai, and I'm the moderator for today's event. I'm really excited about today. Just a couple of housekeeping items. Please put your questions into the chat, and I will make sure that we get to them in some form, either later today or at the end of the presentation or over the course of the next several days by email. I just want to make sure that we give Andres the time to just go through his entire presentation in detail. So I will make sure to watch over that. Just put them into the chat line. Now I'd like to introduce you to our speaker for today, Andres Heuberger. Andres is the Vice President and LEP Advocate at Language Scientific, the topic for today. And Language Scientific is a leader in medical translation. Andres has been involved in the translation industry for over 25 years. Today he manages Language Scientific's relationships with accessibility advocates and oversees relationships with major clients across the world. He regularly writes for industry publications and is a frequent speaker at industry conferences. Without further delay, I would now like to turn things over to Andres Heuberger. Andres, here you go.
Thank you, Saj. Thank you for this introduction, and welcome to all of our attendees. We have quite a turnout today. Really thrilled to be talking about this here. To build on what Saj has just said, I originally hail from Switzerland, so languages are in my background. I do have decades of experience in the medical translation space, although Saj, you shouldn't have mentioned the exact numbers, so it does me no favors. But anyway, I currently act as the VP and LEP Evangelist at Language Scientific and at RxTran, which is our patented multilingual pharmacy labeling solution. Today, I'm really thrilled to talk about the many implications of the recent executive order that mandates English as the official language of the USA. So let's get started on the next page. Over the course of this webinar, we'll explore the widespread impact of the recent executive order that designates English as the official language, and the impact particularly on limited English proficiency populations. We'll also look at the key areas where language access challenges arise and examine implications for pharmacy operations, legal liability, and patient safety. There will be time for a question and answer session at the end of the presentation, as Saj mentioned. All right, next slide, please. Why it matters indeed. It matters in part that multiple studies have consistently shown that language barriers in healthcare settings and specifically lack of consistent access and use of interpreters lead to medication errors, to compromised patient outcomes in general, and have potential legal ramifications. This is true for the entire healthcare system, and pharmacy teams face additional pressure to ensure compliance while maintaining equitable care across a very diverse patient population. To safeguard LEP population health, it is vitally important to address challenges head on because one, yeah, we want everyone to be healthy. Two, the LEP population is large and growing. And three, not addressing health equity issues opens the door to significant risk and liability, something nobody wants. Next slide, please. So how large is the LEP population in the US? Well, the 2020 census has shown that there were roughly 25 million people who fit into the LEP category. Well, that's more than 8% of the population. So that's a significant chunk of all of us. One of the things that's important to know here is that not all segments of the LEP population are the same. For example, the Hispanic LEP population usually speaks some English, not fluently, maybe very broken, but usually are able to communicate a little bit in English. Compare that to Vietnamese speakers, many of whom are literally off the boat, straight off the boat, and speak no English whatsoever. That increases the need for language support and, again, introduces immense risk. And in response to this trend of growth in population, differences between different population segments, states as diverse as Oregon and Texas, as diverse as New York and Nevada, require pharmacies, for example, to provide some of their services in languages other than English. And in fact, Washington State is the latest state to jump on that bandwagon and is rolling out requirements over the next, not quite couple of years, not maybe a year and a half, that bringing the total number of states with some accessibility laws much closer to 10 in total. So more and more states are adding on to these requirements. Next slide, please. All right, let's look at this Executive Order 14224. The two main items in this executive order that President Trump signed 2+ months ago are designating English as the official language of the United States and revocation of an earlier executive order, number 13166. This earlier Executive Order 13166 was signed by President Bill Clinton in 2000, so a quarter century ago. What's important to note here is that all executive orders have a limited reach. They only apply to the executive branch of the federal government. They are not laws, and they cannot overturn existing statutes. That would require Congress. So despite the new executive order and rescission of Executive Order 13166, language access remains the law of the land. But there are details to that which we will explore. Let's go to the next slide, please. But first, let's take a look at what are the implications. And really, this, to sum it up, there's two words: uncertainty and fear. Healthcare providers are struggling to figure out how to move forward, how to comply with different federal agencies changing rules. Many in the LEP population are uncertain what language support exists still, where it will be available, how long it will be available for. So the other factor in this is, and it's not directly related to this executive order, but it forms sort of the bigger picture. There is the fear of getting deported on your way to a medical appointment or to the pharmacy. All this will have a significant chilling effect. It's really a 1-2 punch that literally threatens to pull the rug out from under individuals who are entitled to language access, as well as the providers who want to provide said access, which they know requires effective communication, whatever the language may be. And this may, in fact, be the whole point of this, right? To scare people enough so that they don't feel safe accessing healthcare or asking for assistance from providers. Next slide, please. Interesting thing about essential services. Essential language services in the healthcare space are, in fact, essential because they are proven to provide better outcomes for LEP patients. Medication adherence, for example, improves greatly when patients have consistent access to interpreters, as well as native language drug labels. But I also don't want to be too alarmist here. As I mentioned in the previous slide, different agencies, federal agencies, will respond differently to President Trump's executive order. Yes, Some will eliminate language access and language support altogether. But others will continue to provide this service in some fashion or other. It may look the same as it does today, or it might be slightly reduced. Time will tell. And again, uncertainty follows from that. It's also important to point out that the weakening of federal regulations may flow downhill, but the new executive order does not override, nor does it eliminate any state or local laws. Those still exist. For example, those state level regulations that I mentioned earlier. Next slide, please. But any weakening of federal regulations will undoubtedly lead to cost cutting, increased use of tools such as Google Translate, and just a general lack of language support for LEP patients, which then will lead to huge liability exposure for providers. And all that creates increased risks, negative results in our entire industry ecosystem. So as you're looking at these 5 examples here, note that they are but 5 examples. There are more. All of them are actual, real-world cases that resulted from language mistakes. And we will send you a copy of this presentation over the next 48 hours, and that will have clickable links to these cases that you can explore further if you're so inclined. But it's quite scary, let me tell you that. Next slide, please. So a big sigh of relief for now, because the Affordable Care Act remains the law of the land. As far as language access is concerned, Section 1557 of the ACA is of particular importance. It prohibits discrimination and requires providers to ensure meaningful language access. Next slide, please. As mentioned earlier, executive orders only apply to the branch. The ACA was passed by Congress, and Congress, if it is so inclined, needs to pass a new law to change or revoke an existing statute such as the ACA. This is definitely true. And so is the fact that all members of the executive branch are required to comply with and enforce an executive order. The results, above mentioned uncertainty and the chilling effect that this surely will have. Next slide, please. So here's some interesting things. As executive branch, federal agencies, HHS and DOJ, have already begun to make changes in how they enforce language access. However, they're severely limited by various civil rights laws that also speak to language access. 2 examples here at the bottom. Title VI of the Civil Rights Act of 1964 prohibits discrimination on the basis of race, color, or national origin. This is a broad statute that requires, amongst other things, that healthcare providers that receive certain federal funds provide reasonable language support, such as translated pharmacy prescription labels. The second example here is Titles 6 and 16 of the Public Health Service Act, which requires health facilities that also receive certain federal funds to provide certain services to members of its designated community. For example, non-English posted notices if a certain threshold in a given community is LEP designated. Next slide, please. You know, it's interesting. Yesterday I spoke with a woman who's originally from Brazil, and she casually noted that her parents were in the US visiting, and that her father had to get his prescriptions filled. Since his English is very limited, he really struggled and had difficulty understanding the dosage directions, for example, on the prescription label. Luckily, she was able to intervene, guide him, explain, translate for him. But not everybody is so lucky. Non-native English speakers face these kinds of challenges every day. Pharmacies and providers who support LEP patients will, in fact, attract LEP patients, and that's very good for business. Also, the ROI, if you will, the return on investment of language access, it goes beyond compliance and dollars and cents types of discussions. Studies show that patients with access to interpreters leave the hospital sooner. That means there's capacity that's freed up, more business can be done. It just makes sense all around. It also shows that consistent access to interpreters reduces readmissions by those same LEP patients. And not just reduces it, but cuts it by more than half. Significant health benefits from the availability of interpreting in this example. But again, it just supports, that makes business sense all around. Next slide, please. Let's be realistic. Individuals like you and I don't have a lot of pull with regulators, but collectively we do. And it is advocacy groups, especially on the local and state levels, that have proven to be very effective at convincing lawmakers to regulate and enforce accessibility statutes. In the Oregon example that I gave earlier, so Oregon was the pioneer back in 2019 to introduce State Bill 698, and that bill came about and got enacted into law based to a large extent on the very effective lobbying by various accessibility advocacy groups. And it was like a helter-skelter of different groups working together, but they stayed at it and they got it over the finish line. Now, a lot of states mirror their regulations on that original Oregon bill and expand on that potentially. This was the first state law to require translated prescription drug labels, for example. Next slide, please. And now for a tiny bit of self-promotion. As I mentioned earlier, half a dozen states plus, closer to 8 now, require pharmacies to provide translated prescription drug labels to all patients who request them. That pretty much used to be the market that we serve with RxTran. But in response to the growing LEP population and many of the other issues that I mentioned over the past part of this webinar, we are seeing tremendous growth across the country. That's a trend we fully expect will continue. Next slide, please. The other easy to implement and easy to use really solution for supporting LEP patients is over-the-phone interpreting. It takes just minutes to set up. Is available in even the most obscure languages and is available around the clock, literally 24/7, 365. On this item, if you're interested to learn more, our team will be happy to send you our best practices checklist for over-the-phone interpreting services. Okay, and with that, let's turn to your questions. Saj, I imagine we have received some excellent questions already.
We have, Andres. First of all, just thank you so much. That was an incredibly informative presentation, and I'm sure when everybody gets the presentation with the links that you noted earlier within the next 48 hours from us, they'll learn even more as they click into each one of those slides in more detail. So thank you. All right, so let's get into the questions. There's several of them that I've already gotten. Thank you so much, audience, for sending those. I'll start with the first one, Andres. Um, how might Executive Order 14224, which you mentioned earlier, affect pharmacies' ability to provide accurate medical instructions to LEP patients?
Yeah, good question. So, as I mentioned, Executive Order 14224 revokes previous language access protections. This shift places language access decisions now at the direction of individual agencies. That, in turn, potentially leads to inconsistent policies across different healthcare settings. One probably intended consequence is that pharmacies may very well struggle to provide accurate medical and medication instructions to LEP patients due to said reduced federal guidance and funding for language services, translation services, interpreting services, you name it. Without standardized language access requirements, pharmacies may really face significant operational challenges as they're trying to ensure patients understand their dosages, like the example I gave a minute ago. The side effects that may arise from a given medication, and all the interactions with healthcare professionals, all of which, ensure or increase, I think, the risk of medication errors. And it's just nobody benefits from that.
Great, thank you. I'm just scrolling through the questions here, and I think one of our audience members reacted to that page where you showed the 5 risks, and I certainly thought it was an important slide as well. So let me ask you the question they raised. What are the potential risks to patient safety and pharmacy liability? You had mentioned legal liability if language barriers lead to medication errors. That's an interesting question.
It is an interesting question, and beyond those examples and other ones that exist out there, we're going to find out. The answer isn't fully clear, but clearly miscommunication can lead to incorrect dosages, improper medication use, and failure to recognize side effects, all putting patients at risk. LEP patients already experience high rates of physical harm due to miscommunication, reinforcing the need for professional interpreting services. On the flip side, without clear language access policies and support, importantly, pharmacies may struggle to meet legal and ethical obligations to provide safe and effective care. Let me just run this into Google Translate. I don't speak Arabic, but that's what I asked for. I'm going to print it out and hand it to the patient. Okay. Luck has some room to play, some room to play in this. Pharmacies may also face liability issues if inadequate language support results in harm to LEP patients. Again, how this all rolls out, how the cookie crumbles on the back end of that, to be determined.
Great, that's really helpful. Thank you. Keep scrolling here, and looks like one of our audience members is actually from a pharmacy, and his question or her question is related to pharmacy. So let me ask the question directly. How can pharmacies collaborate with healthcare providers to advocate for the reinstatement of language access policies? What can they do?
Yep. Yeah, it's an interesting question. Fundamentally, that makes a lot of sense. And pharmacies can collaborate with healthcare providers by forming coalitions to advocate for the reinstatement of language access policies. This could include lobbying for legislative action, engaging with policymakers, and raising awareness about the impact of language barriers on patient safety. The advocacy groups that I mentioned earlier play such a big role, and some of them are focused on a given disability, maybe, Some of them might be focused on issues facing a certain ethnic minority, but there's many of them out there. And pharmacies can work with those advocacy groups as well as with hospitals and clinics to implement internal language access programs, ensuring that LEP patients receive consistent, and I think that's a key element, the consistency of that support across different healthcare settings. One last item that I think is worthy to mention in this context is leveraging professional organizations and industry groups can really amplify advocacy efforts and push for policy changes that protect language access rights. So I hope that's helpful.
I think that's a very comprehensive answer. Thank you. Here's another question that came. Looks like one of our audience members is a corporate member from a pharmacy management system or a PMS. Let me ask their question. What role do pharmacy management systems or pharmacy management system companies play in ensuring that pharmacies have the resources to support LEP patients effectively?
Thing. Because I mean, pharmacies, there's a lot of mom and pop, onesie, twosie types of pharmacies, in addition to the chains, of course. But pharmacy management systems, PMS, play really a crucial role in ensuring pharmacies have the tools to support LEP patients and do so effectively. PMS providers many of them integrate translation features into prescription labeling and patient instructions, helping the end pharmacy to comply with language access requirements. But at least one PMS that I'm familiar with, they leverage Google Translate and have been. And again, I'm not privy to the risk and liability assessments that were done there internally. I'd love to be a fly on the wall, but okay, again, we'll see what happens there. But by making pharmacies aware of the translation capabilities that exist within these platforms, and that doesn't always happen, but by making pharmacies aware, PMS companies can really help pharmacies navigate the challenges posed by this executive order and maintain high standards of patient care, which I know every pharmacist is interested in. There's no exceptions to that.
Great. What a great answer. Thank you. That's very comprehensive again. Thanks so much, Andres, for being here today. Trying to be mindful of time here. We have just about hit our half an hour mark here. And we want to make sure that we respect everybody's time that's in the audience. So thank you, everybody, again, for joining us. This has been a great participation. I know I learned a ton from Andres, our LEP advocate at Language Scientific. I hope you guys did it the same. And I know, just to reestablish what Andres said earlier, and I said also earlier, within the next 48 hours, a member of our team will send you a copy of this presentation in PDF form, hopefully with the links inserted so that you can go deeper into each one of the links if you'd like to. And we'll get back to you by email. So if you have any questions, you can always respond back to languagescientific.com, as Andres mentioned at the beginning of this presentation, and we'll be sure to take care of any of your needs. Again, thank you, everybody, for participating. And Andres, thank you on behalf of everybody in the audience for such a great and informative session. This ends today's webinar.
Thanks, everybody.